Today, I want to talk with you about something that affects many people, sciatica, and a treatment approach called spinal decompression therapy that some find helpful. I know dealing with nerve pain can be really challenging, so let me explain this in a way that makes sense. First, let's talk about what sciatica actually is. Your sciatic nerve is remarkable. It's the largest nerve in your entire body. It starts in your lower back, travels through your buttocks, and runs all the way down both legs to your feet. Think of it like a major highway carrying messages between your brain and your legs. When this nerve gets compressed or irritated, it can cause what doctors call radicular pain, meaning the pain radiates along the nerve's path. People often describe sharp, shooting sensations, pins and needles, or numbness traveling down one leg. And I understand this kind of pain can really impact your daily life. The most common reason this happens involves something called a herniated disc. Picture your spine as having cushions between the bones. These are your intervertebral discs. Each disc has a tough outer shell with a soft, gel-like center. Sometimes that soft material can push through a weak spot in the outer layer, and this herniated material might press on the nerve roots that form your sciatic nerve. But there are other possible causes too. Sometimes the spaces where nerves pass through can become narrowed, a condition called spinal stenosis. Or you might have a muscle deep in your buttocks that's putting pressure on the sciatic nerve. That's called piriformis syndrome. Sometimes one vertebra can slip forward over another in a condition called spondylolisthesis. Now this is where spinal decompression therapy comes in, and I think you'll find this interesting. This treatment uses a specialized computer-controlled table that creates gentle traction on your spine. The idea is to create what's called negative pressure within the discs, kind of like a gentle vacuum effect. This computerized approach is quite sophisticated. The machine can actually sense when your muscles start to tense up and automatically adjust to work with your body rather than against it. It uses gradual pressure changes designed to help your muscles stay relaxed during treatment. For sciatic issues, practitioners can position you at specific angles to target the exact area where they believe the problem might be occurring. During a session, you might feel a gentle stretching sensation, but it shouldn't be uncomfortable. The machine typically creates traction for about a minute, then releases for 30 seconds, repeating this cycle for around 25 minutes. The theory behind this approach is that the negative pressure might help encourage herniated disc material to move away from the nerve, potentially increase blood flow to bring healing nutrients to the area, and possibly reduce inflammation around the irritated nerve. What I find encouraging about this approach is that it's designed to potentially address the underlying mechanical issue rather than just managing symptoms. A typical treatment plan might involve multiple sessions over several weeks, often combined with specific exercises to strengthen the deep muscles that support your spine, along with guidance on posture and movement. But here's what's really important to understand. Sciatica can have different underlying causes, and what helps one person might not be the right approach for another. Some people find significant relief with decompression therapy, while others might benefit more from different treatments entirely. The most crucial step is getting a thorough evaluation from healthcare professionals who really understand these conditions. They can help determine what's actually causing your specific symptoms and work with you to explore treatment options that make sense for your particular situation. I know dealing with sciatic pain can be frustrating and limiting. The good news is that there are various approaches available, and many people do find relief. Spinal decompression therapy represents one option that uses precise, computer-controlled methods to create conditions that might support your body's natural healing processes. Remember, every person's situation is unique,